If you're thinking about getting pregnant, or even if you're not sure yet, this might be one of the most important conversations you never knew you needed. Because one simple question can completely change the outcome of a pregnancy. Would you like to become pregnant in the next year? That question alone is where better pregnancies begin. And I'll tell you why. In my practice, I've taken care of countless pregnancies, and the truth is, most pregnancies, planned or not, turn out okay. But here's what I've also seen. I've seen women coming pregnant not knowing how far along they are because their cycles were irregular. I've seen women taking medications that could affect the baby without even realizing they were pregnant yet. I've seen patients dealing with uncontrolled diabetes, high blood pressure, thyroid disease right at the start of pregnancy, when the baby is developing the fastest. And I've seen the stress that comes with that. The anxiety, the guilt, the I wish I had known sooner. But I've also seen the other side. Patients who planned ahead, who optimized their health, who reviewed their medications, who made small changes before pregnancy and avoided complications. Same patients, same pregnancies, very different experiences. And that brings us to the most important idea in this entire video. The healthiest pregnancies don't start at the first prenatal visit. They start before conception. So what does preparing for pregnancy actually mean? Let's break it down simply. Number 1, folic acid. It's foundational. Every woman of reproductive age should be taking ideally 400 to 800 micrograms of folic acid daily. This reduces the risk of neural tube defects, serious conditions affecting the brain and spine. And this needs to start at least 1 month before pregnancy, because by the time you find out you're pregnant, that window may already be closing. 2, chronic medical conditions. If you have conditions like diabetes, high blood pressure, thyroid disease, depression or anxiety, these should be optimized before pregnancy. For example, if you have diabetes, we aim for a hemoglobin A1C below 6.5 before conception, because uncontrolled blood sugar early significantly increases the risk of birth defects. Number 3, medication review. Not all medications are safe in pregnancy. That includes prescriptions, over-the-counter meds, supplements, herbal products, and this is one of the most overlooked risks. Many exposures happen before someone even knows they're pregnant. Number 4, lifestyle factors. This is where small changes make a big difference. Stop smoking, avoid alcohol, avoid drugs, and aim for a healthy weight. Even a 10% weight loss before pregnancy if you're overweight can significantly reduce risks like preeclampsia, gestational diabetes, stillbirth. Number 5, nutrition. Make sure your body has what it needs: iron, calcium, vitamin D, vitamin B12, and avoid high mercury fish, foods that carry risk for food poisoning, specifically from listeria. Number 6, immunizations. Before pregnancy, check protection for rubella, varicella, hepatitis B, Tdap, influenza, because some vaccines cannot be given during pregnancy. And here's the key. All major medical organizations in the United States and internationally agree on these recommendations. This isn't controversial. This is a standard, evidence-based care. But the problem is most people don't get this information until after they're already pregnant. So let me bring it back to that one question. Would you like to get pregnant in the next year? If the answer is yes, your preparation starts now. If the answer is no, you still need to protect yourself from unintended risks. Because again, the healthiest pregnancies don't start at the first visit. They start before conception. If you're thinking about pregnancy or even just not sure yet, drop your questions in the comments. I read them all, and I'll use them to create more videos that'll help you feel informed, confident, and prepared. Thank you.